in a similar situation. This is a high mountain city. It sees significant wintertime inversions and high tourism, the Sundance Film Festival, which of course requires a lot of emissions to get up and down the mountain. But poor air quality paired with the mountain topography is well known to lead to extended episodes of atmospheric inversions with trapped pollution, especially fine particulate matter, especially PM 2.5. So research on urban air quality increasingly suggests that air pollution impacts a range of social, economic, and health impacts, everything from educational outcomes to workforce productivity, and a number of health outcomes, including asthma, COPD, cardiovascular disease, pneumonia, depression, mortality, and of course, several types of cancer. And as was just presented in the excellent work by Chanterelle, emerging research has also suggested that COVID-19 incident rates may be associated with air pollution exposure. And as we discussed briefly, it may also be responsible for the spread of other types of diseases in urban areas as well. So the good news is that since the pandemic began, governments have produced a range of non-medical interventions, things like lockdowns or stay-at-home orders, mask mandates, and this has helped to prevent the spread of COVID-19. But an important co-benefit from these policies has been the measurable improvement in air quality in cities around the world. This has included a substantial drop in the concentration of primary pollutants such as nitrous oxide, carbon monoxide, ammonia, a variety of other chemicals as well. And even when a range of meteorological conditions are considered, the 50 most populous cities in the world experienced about a 12% drop in air quality or air pollution on average, with some estimates ranging from somewhere between 10 to 43% reduction in PM 2.5 in particular. And while the dramatic dip in emissions is expected during a pandemic, no one's surprised to hear that finding. Pollution downturn events are an especially rare occurrence, yet they're becoming more common. So the economic downturn in 2008 was studied fairly deeply, but prior to that, there's been less work in understanding how these pollution downturn events affect air quality and what the consequences of the rebound from these events might be. So as a result, less is really understood about the changing composition of air quality in the local setting when these things occur, and if such changes have important policy consequences over the longer term. So considering the increased uncertainty that changing emissions might bring, the impact that might have on things like adaptation planning or resiliency or even low carbon transitions internationally, it becomes important to think about emission downturn events and what might be the outcomes of these. So this led us to better understand or to begin studying how air quality and energy policy may be impacted by pollution downturn events. To do this, we use these pandemic policies that were created as a natural experiment, as a unique opportunity to possibly study these to understand the consequences. So our team traced the changing emission patterns produced under the pandemic in a mid-sized, high-altitude city to try and isolate the effects of human behavior on air pollution patterns. We also tracked pollution concentrations over the pre-lockdown, lockdown, and 2 reopening stages, an easing and then a reopening stage that I'll discuss in just a minute, using high-quality research-grade sensors to try and capture pollution patterns found before, during, and after the pandemic lockdown period. We then compared emission levels in both commercial and residential settings over similar time periods of the pandemic to try and understand if these settings were uniquely impacted by the changing emission patterns. We hypothesized essentially that residential communities should have less of an impact and that we would see these greater changes on the commercial side. Quantifying and characterizing air quality over varying periods of policy implementation gave us a unique opportunity to understand future air quality scenarios as well. We imagined that in the future that transition would not go as specifically and easily as we had originally expected. And we wanted to shed light on how these changing patterns could impact energy policy at all levels of governance. So to study emissions patterns, we used a physical exposure model, a compared diurnally averaged PM 2.5 levels using research grade sensors, as I've mentioned. And the idea was to study air quality downturn and extreme pollution in this semi-isolated setting. The study period for the research spanned from February 3rd to July 23rd, 2020. As you can see, the pre-lockdown period served as a sort of baseline period. We do realize there should be some reductions in behavior at that point of time as well. And so it's not a pure baseline, but we included also a lockdown period, an easing period, and a reopening period. The easing period is distinct from the reopening period because there were still some regulations in place that prevented businesses from being open at certain times and things like that as well. So I'd be happy to talk about the breakdown of those periods, but we specifically tried to keep the length of time in the periods relative to each other. And we did check for seasonal effects of transitioning through the colder seasons into the warmer seasons during the pre-lockdown period. We did a sensitivity test, and we actually found similar results to the full study period. So I wanted to make note of that early on. For our data analysis, we aggregated all the data to an hourly scale and the type of day, meaning weekend or weekdays, expecting to find different patterns between those day types. We used median values for each study period, the site and day type as well, and we compared these diurnal patterns and calculated the percent change across the different study periods. And to compare change between the study sites and policy periods, we simply performed simple t-tests to compare the percent change in PM 2.5, which was the emissions we studied for this project. Since everyone likes to ask, we like to talk about the instrumentation and what we used. The study had 2 research grade sensors located at both a commercial site and a residential site in Park City. The research grade sensors have been shown to be comparable to regulatory grade sensors, and our original sort of impetus for the study was to create some feedback for the city of Park City, and research grade sensors were more appropriate for informing the city in the short-term span of time that we were trying to react. Likewise, there were significant, these are fairly robust sensors, and so we wanted to use high-quality sensors for this purpose. The sensors themselves were installed outdoors and were optimally sited to avoid hyperlocal influences, particularly wood-burning stoves in the residential area specifically. So the commercial sensor was located downtown in Park City in the Old Town neighborhood. It's one of the busiest parts of the city. And in contrast, the residential sensor was located in Park City's Municipal Athletic and Recreation Center, the MARC building, which is located just outside an established residential community. The sites were chosen for high quality sort of performance, et cetera, and served us quite well in terms of setting the outcomes of interest in this research. So we began by hypothesizing that the lockdown period would decrease pollutant concentrations. One of these, well, does it really do what we expect it to do sort of questions. And in fact, we were surprised at some of the answers that came from these simple questions about reductions in emissions during the lockdown and what we expected to find following that in the opening and easing periods. So during the lockdown period, as I mentioned, we expected overall PM 2.5 levels to decline and rebound with some variation over the policy periods. You're looking at figure 3 here, and it illustrates or shows that the median hourly PM 2.5 readings for the commercial site, which is what we're looking at in this image, separated out by weekend and weekdays, and then displayed in hourly intervals for convenience of display. Because the commercial site is located at the heart of downtown Park City, the lively evening dining and entertainment activity resulted in higher elevated pollutants between 6 p.m. and midnight in that pre-lockdown period noted with the blue line. So we sort of see that as that primary period closer to the baseline of what we would expect in a normal day-to-day period. Since Park City is a high elevation mountain basin which observes nocturnal stable layers, we weren't surprised to find the amplification of PM 2.5 levels between 6 p.m. and midnight beyond what would have occurred in a nocturnal state if this stable layer didn't exist. But it's clear that during the lockdown, noted in the red dash, we saw a marked increase in pollution, and even the evening easing period, the gray dash period, had a decrease in pollution, and had the gray also, the easing period also had a lower PM 2.5 rate than the pre-lockdown stage, as would be expected. And it's only during the second reopening period when the evening peak begins to reappear again, yet at a much lower rate. And interestingly, we noted that this pattern was similar for both weekdays and weekends, which is contrary to what we had previously expected to find, at least in the commercial area. When we think about this same hypothesis and explore the residential location, again, here in figure 4, we're displaying the median hourly PM 2.5 readings for the residential area. And similar to the commercial site, we found a comparable decrease from the pre-lockdown period, the blue line, to the lockdown, the red dash, and the gray easing line. A notable feature, though, in the residential area is that the evening pollution peak started at about 6 p.m. and ended around midnight, which is found during the pre-lockdown period for both the weekends and the weekdays. Without the use of speciated particulate composition data, it's difficult to identify exactly what was causing that effect. We assume that it's from the use of wood-burning stoves in the area, which is a common feature of the Park City area. Another contributor, of course, to evening pollution might be people returning home at night, so transportation emissions, especially coming up the mountain, maybe concentrating and appearing first in the residential areas where many people have to drive through from the outer reaches of the residential areas to get to the downtown area. In addition to the higher nighttime pollution peak in the pre-lockdown period, we also found that the reopening period showed a proportionally larger increase in PM 2.5 readings compared to the commercial site, which we found unusual and also unexpected. Our second hypothesis really is trying to look at if the lockdown period affected pollutant levels in commercial and residential areas differently. And here is where we became quite surprised at the outcome. So table 3 here illustrates the percent differences in median pollutant concentrations recorded by each site across the comparative policy periods and days of the week. All the results for the weekdays were statistically significant, showing that pollution during workdays varied across these time periods in important ways. The lockdown to easing transition, for example, was the least significant in terms of pollutant concentration variability, and this can be attributed to a slow recovery from the lockdown itself that was found in Park City. Furthermore, the residential weekend pattern showed little change from the pre-lockdown through the lockdown and easing periods. And this was likely due to the residential aspect of the neighborhood, right? These policies themselves were put into place mainly to stop businesses and to prevent people from interacting in commercial districts. And so this sort of distinct difference between residential and commercial locations was largely that the pandemic policies affected some parts of the city more than others as a result of the policies themselves. To get at this hypothesis, or more distinctly, we also wanted to compare the difference in median pollutant concentration change across the policy periods for commercial and residential sites. So in this table, table 4, the additional analysis tries to clarify whether the commercial and residential areas showed different pollutant gradients across time periods when compared. In this case, only 2 results were found to be statistically significant. The first was the pre-lockdown to lockdown differences during the weekends, and table 4 shows that the residential site observed no difference during those 2 time periods, but the commercial site showed a drop of nearly 36%, quite dramatic difference between the 2 locations. This suggests that the commercial area saw a relevant decline in emissions during the lockdown period, but the same impact was not actually found in residential areas. Therefore, the lockdown policy reduced pollution concentrations in commercial areas as everyone expected, but it didn't do so in the residential ones, which is consequential for policy. The other statistically significant difference was during the weekdays for the lockdown and reopening time periods. In this case, the residential site showed a higher rate of pollution increase over the policy periods, and this suggested that the residential area had a significant increase in pollution while the commercial areas didn't experience a rebound yet. That was also quite surprising to us. Despite this, the overall emissions remain low and aggregated. So when these two different sites are sort of aggregated and put together, it can be quite misleading in terms of where the reductions are occurring within a city. And that again could be important for human exposure and other types of relevant policy aspects of that issue.
4 minutes left.
Based on this research, of course, there's going to be several important findings. Under the lockdown, we expected overall emissions to decline, and that did occur in the commercial area consistently across all the periods of the policy. Even today, emission levels have not returned to the pre-pandemic levels. In contrast, the residential area showed this effect only in the early stages of the pandemic. With the exception of weekday evenings, the residential areas only saw a small decline in emissions in the lockdown and easing periods, but have already returned to the pre-lockdown level. Although meteorological conditions could be playing an important role in what we observed, we were able to note that the reopening period shows an impact that is quite distinct. And so we believe that the climatic variables were most likely minimal, at least in this study specifically. In addition, the differences between the commercial and residential sites across the policy periods, we found statistically significant differences by hour between the locations. And this suggests daily differences in emission peaks between commercial and residential areas that were consequential. Finally, these findings demonstrate that changing patterns across the study periods within each sites were also unique. So the results of changing human behavior and emission peaks were quantitatively different for commercial and residential sites across and within similar study periods. And this varied uniquely by these different locations. The implications of this are quite broad, but yet they're quite important. First and foremost, it's widely accepted that cities have consequential emission exposure effects that vary widely. We talked about this in the last talk, that it's difficult to pinpoint individual exposure. Yet emissions reporting is generally aggregated to the city level, and nuances like those that we're presenting here can largely be missed as a result of that, but these aren't without consequence. There's also the cost of sensor technology, which will often lead to estimation and other forms of techniques. But much of the research around modeling and estimation could possibly miss many of the things that we found. So while it's useful for these cost-saving techniques and monitoring purposes, it's important, especially in rare pollution downturn and rebound events, for us to use direct measurement and high-quality direct measurement whenever possible. Such findings are relevant for researchers and policymakers alike. There's potential health impacts from these findings, and increased pollution exposure, especially in minorities in cities, are relevant in terms of the findings that we presented here. We also believe this research has implications for energy and air quality policy at all levels of governance, again, for local exposure, for local legislation, for national determinants. And lastly, of course, for the implications of climate change and the COVID-19 recovery as a result of that. So our research has shown that there are important emission patterns that resulted from the pandemic and the changing behavior patterns that were presented. Most notably under the lockdown period, PM 2.5 pollution declined in both residential and commercial areas. However, the commercial areas showed a greater decrease in air pollution than the residential ones, but experienced a similar rebound post-lockdown. These findings illustrate the usefulness of this approach and show how energy policy could be impacted by ongoing changes caused by the global pandemic and changing work patterns, as well as a global economic downturn in combination. As a result of this research, it has implications for a variety of policy fields, as well as public policy and human health. Thank you very much. I look forward to your questions.
Thanks, Tabitha. We have time for, we actually don't have time for questions. You can ask them in the chat if you like, and Tabitha can respond if she's willing. But thank you so much. That's really interesting work.